cancer among the African American or the black population. I think that what we've already indicated is that certainly cancer is no respecter of persons.
That's correct.
But I think that in many instances we find that when we talk about strokes or cardiovascular diseases, just a whole wide range of other diseases, it is possible to perhaps point out what we call the African American dimension of those diseases. Excuse me. Let's do the same thing in reference to cancer. Let's look at cancer in blacks. Are black people more prone to cancer? Are their lifestyle? Let's talk about that.
Yes. Unfortunately, blacks tend to suffer most and have the worst adverse outcomes with regards to most of the major diseases with which we deal. Cardiovascular diseases or heart diseases are the leading cause of death in this country and most Western countries. However, cancers, those diseases hold the #2 position, and it makes up about 20% of all-cause mortality or all causes of death of all individuals in this country. And it is slated to become the leading cause of mortality or death by early 21st century. For blacks, the highest group, the group with the highest mortality from cancer happens to be blacks, which is approximately higher than that of whites, approximately 40% higher, and except for black females, which is lower than white females. And whites, their mortality or death rate tends to be 40% higher than that of Asian Americans, such as Japanese and Filipinos and Chinese, when you lump those together. In addition to that, blacks have a high incidence or occurrence rate for many types of cancers and most of the major types of cancer. And we also tend to have, blacks tend to have a lower survival. In other words, they have a lesser survival rate. It's about 50% cancer survival, long-term cancer survival for whites, and it's about 35% for blacks. So you see that the outcome parameters are much worse for blacks as compared to whites. And it's a significant public health problem because we're talking about large numbers of individuals. Since about 1.2 million people in America are expected to have cancer this year, and more than 500,000 individuals will die of cancer. So it's not an unsubstantial number of individuals. Approximately 120,000 blacks will have cancer, about 20% of the total number.
And so the topic that we're talking about this morning ought to be a topic of some interest to all Americans, but especially to black Americans.
That's correct.
With that mortality rate of 40%. Now, you mentioned that there's a higher mortality among black males than among white males, but yet there's a smaller mortality among black females. What's the cause of the discrepancy between those two groups of individuals?
Most likely is secondary to two major cancers, which make up a large proportion of the cancers that individuals have. And those are lung cancer and prostate cancer. Lung cancers are higher, the rate is higher in blacks as compared to white males. And prostate cancer is approximately 50% higher. Incidence of invasive, clinically significant prostate cancer is about 50% higher than in white males. In
fact, black males than in...
That's right. Black males in the United States have the highest rates of prostate cancer of any group in the world. And Africans, blacks who live in Africa, have a low rate, relatively low rate to our knowledge of prostate cancer.
And so there's sort of a peculiar situation dealing with blacks dealing with prostate cancer. Now, what are some of the reasons for this then, Doctor? I mean, what are some of the, at least some of the projected causes for this?
Okay. For lung cancer, we know that the major cause of lung cancer is cigarette smoking because in 1930, 60 years ago, or 63 years ago, the incidence, the rate of occurrence was about 4 per 100,000. The rate of occurrence of lung cancer in the whole population now is about 71 or 72 per 100,000. So it's a tremendous increase, and that's directly attributable to cigarette smoking in 80 to 85% of the cases.
And so you can actually say that the smoking of cigarettes and tobacco really, I mean, you've got a direct line to cancer and the consumption of tobacco. Is that what we're saying?
Absolutely. We feel that cigarette smoking and tobacco use is responsible for 30% of all the cancer that we have. That's a large number of individuals. So you could reduce the level of cancer greatly if we stop smoking. Also, cancer is associated with dietary habits and factors, excessive amounts of animal fat that is eating as opposed to the eating of a lot of vegetables and fruits, etc., is associated with possibly development of cancer such as prostate and breast and colon cancer, certainly, and endometrial cancer, or cancer of the womb. So those things are probably related to dietary and lifestyle factors as well.
And looking at dietary factors, if you had to talk to people this morning about some of the warning signs dealing with dietary factors and cancer and et cetera, what are some of the things that you'd say in terms of the diet and what they ought to include in their diets and that kind of information about fruit and vegetables or whatever?
I think that they should include vegetables and fruits as much as possible. Eat those things every day. Cut down on the amount of meat that you eat, especially red meat. The meats that you eat, make the larger proportion be fish and chicken. Cut down on the fats that you eat, so you might remove the skin. Eat nuts. The foods that you eat should be a variety of foods, because some foods may have exorbitant amounts of some factors that might be deleterious if you or harmful if you had too much of one specific type of food.
What kind of food would you identify as a food that would have a tremendous impact upon a person in terms of cancer causing?
In terms of causing cancer, I would not like to incriminate any, but I would say that one should you eat probably red meats judiciously and wisely, and probably not excessively. I think that's.
And that would, you think that would sort of reduce the